Picture yourself sitting at a family dinner, surrounded by the people you love, while laughter suddenly rises from the other end of the table. You smile with everyone else, yet inside, you feel a small sting because you did not fully catch what was said. At first, it seems like a tiny thing almost too small to mention, but your heart notices it anyway. You start wondering whether the room was simply noisy, whether people spoke too fast, or whether something deeper is changing. That private moment matters more than most people realize because hearing changes often begin quietly, long before they feel serious. For many adults over 60, hearing loss does not arrive like a dramatic switch, suddenly being turned off forever. It often begins as a soft blur, a fading edge, a missing word, or a conversation that feels harder to follow. And because the change happens slowly, many people assume it is nothing more than normal aging and leave it there. But that assumption can delay helpful action, useful support, and small daily habits that may ease the strain of listening. So, today this health information channel wants to share something practical, hopeful, and grounded in what current research suggests. We are going to talk about why hearing changes after 60 deserve attention and what simple daily care may support better listening comfort. The first thing to understand is that hearing changes in later life are extremely common, and you are not alone. According to the National Institute on Aging, about 1 in 3 older adults experiences some degree of hearing loss. The National Institute on Deafness and Other Communication Disorders reports that hearing loss becomes much more common after age 65. That means millions of older adults are trying harder to hear, asking people to repeat themselves, and feeling more tired afterward. So if conversations seem more muffled lately, that does not make you weak, careless, or somehow behind everyone else. It means you are experiencing something very common, but also something that deserves care instead of quiet resignation. Many people wait too long because they believe hearing problems only matter when sound becomes extremely faint or almost absent. In reality, the earlier stage can already affect mood, energy, memory, confidence, and the desire to join social situations. That is why this topic matters so much for adults who want to stay connected, sharp, independent, and emotionally present. The goal is not fear, and it is certainly not panic, because fear rarely helps the body or the mind. The goal is awareness, because awareness opens the door to earlier care, better habits, and more realistic support. One of the most common beliefs among older adults is that hearing decline is fixed and completely out of their hands. Many people think the only path is to wait, struggle quietly, and eventually depend on a hearing device. Now, to be clear, hearing aids can be helpful and important for many people, and there is no shame in that. But the story does not begin and end there, because hearing is influenced by more than the ear alone. Age-related hearing loss is real, and the tiny sensory cells inside the inner ear do change over time. Still, the daily experience of hearing difficulty can also be shaped by circulation, muscle tension, noise, exposure, attention, and brain processing. That means the feeling of struggling to understand speech is not always explained by aging alone. You may hear the sound itself, yet still miss the meaning because your system is working harder than before. You may notice that restaurants feel overwhelming, family gatherings feel tiring, and group conversations become easier to avoid altogether. Those experiences are not imaginary, and they are not simply signs that you should give up and accept less. They are signs that your hearing system may need more support, more attention, and sometimes a proper medical evaluation. This is where the topic becomes more interesting and more hopeful than many people expect at first. The inner ear depends on healthy blood flow, and researchers have long recognized that circulation plays an important role there. The structures inside the ear are delicate, active, and demanding, which means they rely on a steady supply of oxygen and nutrients. When circulation is less efficient, the clarity of hearing may be affected, especially in older adults with cardiovascular risk factors. That does not mean every hearing problem comes from poor circulation, because the body is always more complex than one explanation. It does mean the ear is part of a larger living system, not an isolated box attached to the side. Your hearing experience is also influenced by tension in the jaw, stiffness in the neck, posture, fatigue, and sensory overload. If your neck and jaw stay tight for long periods, the whole head and face can feel more strained. If your body is tired, anxious, or overloaded, the brain may have more difficulty filtering important sounds from background noise. That is why some older adults say, "I can hear people talking, but I cannot understand them clearly anymore." Often they are describing not only ear changes, but also the extra work their nervous system is doing. Many older adults believe hearing loss is just an inconvenience, but that description is far too small and incomplete. When hearing becomes difficult, conversation often becomes work, and work eventually becomes fatigue if the effort never stops. You begin leaning forward more often, watching lips more carefully, and filling in missing words with guesses. That constant effort can leave you mentally drained, even after something that should have felt warm and enjoyable. Research has also linked hearing loss with social isolation and loneliness, especially when people slowly withdraw from conversation. Some older adults stop speaking up because they feel embarrassed about asking others to repeat themselves several times. Others keep attending gatherings yet sit quietly in the middle of the room, feeling farther away than anyone notices. That emotional distance matters because human connection is one of the strongest supports for healthy aging and emotional balance. There is also growing attention to the connection between hearing health and cognitive health in later life. Recent reports, including the Lancet Commission, continue to identify hearing loss as an important modifiable risk factor related to dementia. That does not mean hearing loss automatically leads to dementia, so nobody should hear that and lose hope. It means hearing deserves attention because staying connected to sound may also support the way the brain stays engaged. Now comes the hopeful part, and it is important to keep this hope realistic, gentle, and medically responsible. No daily routine can promise to reverse every form of hearing loss or replace proper testing by a qualified professional, but supportive daily habits may help the surrounding systems that influence how hearing feels from morning to evening. That includes areas like circulation and muscular tension, body awareness, posture, relaxation, and attention to environmental sound. Sometimes the most meaningful improvement is not hearing everything like you did decades earlier in your life. Sometimes it is feeling less pressure, less listening, fatigue, less frustration, and more confidence during ordinary conversations. That kind of change may seem modest on paper, but in real life, it can feel deeply meaningful. It can mean joining the family table more easily, feeling calmer in conversation, and ending the day less exhausted. So, the purpose of the routine we are about to share is simple and practical. It is meant to support the hearing system, reduce unnecessary strain, and encourage more active, mindful listening each day. It takes only a short time, requires no equipment, and can be done in a chair or beside the bed. Please remember that this is a gentle wellness practice, not a medical cure, and not a replacement for hearing care. If you have sudden hearing loss, ringing in one ear, strong dizziness, pain, or a clear difference between both ears, seek medical advice. If conversations have become consistently difficult, it is wise to mention that to your doctor or hearing specialist soon. A hearing evaluation can help identify what is actually going on and whether additional support would make daily life easier. That said, a simple home routine may still be a valuable part of your overall care and awareness. Think of it the same way you think about stretching stiff joints or brushing your teeth every morning. You are not claiming to solve every problem with one habit, but you are supporting your body consistently and respectfully. That attitude matters more than people think, because the body often responds best to steady attention rather than dramatic effort. So if you try these steps, do them gently, do them regularly, and let the goal be supported rather than perfection. Now, let us move into the routine itself, step by step, in a way that feels calm and easy to follow. 1. Warm. The ears with your palms and let the body settle first. Begin by placing both palms gently over your ears so the ears are softly cupped and covered with warmth. Do not press hard and do not rush, because the first goal is simply to create a sense of calm attention. Take a slow breath in through the nose, then breathe out gently while keeping your hands where they are. Stay there for several quiet seconds, and notice whether the area begins to feel warmer, softer, or slightly more relaxed. This step may seem almost too simple, yet simplicity is often what older bodies respond to most comfortably. The warmth can help the area feel more alive, while the pause invites your nervous system to slow down. That matters because listening becomes harder when the whole body is tense, hurried, or pulled in different directions. By beginning with stillness and warmth, you are telling your body that this is a moment of care, not pressure. Many people notice a faint sense of calm right here, even before any movement begins, and that is valuable. The body often benefits when comfort comes first and effort comes second, especially in later life. 2. Gently move the outer ear to wake up sensation without causing any discomfort. Next, use your thumb and index finger to hold the outer rim of each ear very gently. Pull outward slightly, then a little upward, and finally a little downward, always keeping the motion soft and controlled. There should be no pain, no strong pulling, and certainly no force because gentle stimulation is enough here. The purpose is to bring awareness to the outer ear and to loosen the area after sleep or inactivity. The outer ear contains rich sensory input, and light touch may help the region feel more awake and responsive. Some researchers are also interested in the ear as an access point for nervous system regulation, including vagus-related stimulation. That does not mean a simple ear movement replaces medical therapy, and we should not overstate what it can do. But it does support the idea that the ear is neurologically active and worthy of more mindful daily attention. For older adults, this step can be especially useful in the morning when the body often feels slower to engage. A few seconds of gentle movement may help the ears feel less dull and the face feel a little more alert. 3. Massage the area behind the ears to reduce tension and encourage a sense of ease. Now, place 2 or 3 fingers behind each ear near the bony area where many people hold quiet tension. Use small circular motions and keep the pressure comfortable, as if you are easing stiffness rather than digging into the tissue. Continue for several seconds and notice whether one side feels more tender, tighter, or more sensitive than the other. If one side does feel tighter, stay there a little longer, but always with care and patience. Many older adults describe a feeling of pressure, heaviness, or fullness around the ears, especially in the morning. This step may help that area feel less congested and more open, even if the change feels subtle at first. It can also be soothing for people who hold stress in the jaw, neck, or sides of the head. Again, the goal is not a dramatic effect in one moment, because the body often works more quietly than that. The goal is to reduce unnecessary tension around the hearing system and make the whole region feel more supported. Sometimes a little more comfort around the ears changes the way the rest of the head feels during the day. 4. Rub the whole ear, gently to increase awareness and stimulate the outer tissues. Using your fingers, rub the front and back surfaces of both ears with a brisk but gentle motion. You are not trying to create friction for the sake of it, but rather to wake up the outer ear fully. Move across the entire ear, including the upper rim, the middle portion, and the softer lower part. This can create a pleasant feeling of warmth and a clearer sense that the ears are active and alive. Some traditions have long viewed the ear as an important map of the body, while modern thinking emphasizes sensory stimulation. You do not need to choose between those views to benefit from a simple, comfortable daily self-care practice. All you need to do is notice how the area responds when you give it regular kind attention. For many people, this step feels energizing without being tiring, which makes it easy to keep doing consistently. And consistency matters because the body often responds to repetition better than it responds to intensity. This is one reason short routines are often more helpful than complicated plans that feel overwhelming and easy to skip. 5. Release the neck, because a stiff neck can make listening feel more fatiguing. Now, bring your attention to the neck, which plays a larger role in comfort than many people realize. Slowly tilt your head toward the right shoulder and hold there gently without forcing the stretch deeper than feels natural. Return to center, then tilt toward the left shoulder with the same calm, easy movement and the same patience. After that, lower your chin softly toward your chest and pause while letting the back of the neck lengthen. The purpose is not flexibility for its own sake, and it is definitely not a dramatic exercise routine. The purpose is to reduce stiffness around the muscles and fascia that influence comfort throughout the head and neck. Older adults often wake with neck tightness from sleep position, reduced movement stress, or long periods of sitting. That tension can make the entire listening experience feel more effortful, especially when conversation already requires concentration. A softer neck often means a calmer face, a looser jaw, and a body that feels less defensive overall. Even if the hearing itself does not change immediately, the strain around it may begin to ease. That alone can make talking with others feel less exhausting and more emotionally manageable during the day. 6. Hum softly to bring gentle vibration through the jaw, throat, and skull. Close your mouth, breathe in slowly through your nose, and then make a soft, low, humming sound. Do not push the sound hard, and do not worry about musical quality, because this is not a performance. Just let the vibration travel naturally through the jaw, the throat, and the bones of the face and head. Many people are surprised by how soothing this feels once they stop judging the sound and simply experience it. The value of this step is that it brings sound inward, not only from the outside world, but from your own body. That can increase awareness of vibration and help some people feel more connected to the act of listening itself. Humming is also calming for many older adults, especially when paired with a slow breath and relaxed shoulders. Research interest exists around vibration, sound processing, and the pathways involved in hearing, though we should stay medically careful. So rather than making exaggerated promises, it is wiser to say this step may support sensory awareness and relaxation. And sometimes those two things together create a more comfortable listening state than people expect from something so simple. 7. Sit quietly and listen. On purpose. So the brain rejoins the conversation. After all the movements are complete, sit still for a short moment, with your eyes gently closed if that feels comfortable. Do not hum now, and do not move right away, because this final step depends on quiet attention. Simply listen to the sounds around you without trying to judge them or force them into meaning immediately. Maybe you hear a refrigerator humming softly, birds outside, a fan turning distant traffic, or your own breathing. This step matters because hearing is not only about receiving sound, but also about how the brain attends to it. When you pause and listen with intention, you give your brain a chance to participate more actively again. That is especially meaningful for older adults who have spent months or years listening in a strained, defensive way. Instead of chasing every word with stress, you are practicing a calmer relationship with sound itself. No, this is not magic and it is not a cure, but it can be a useful form of gentle auditory attention. Sometimes the quietest step in a routine becomes the one that changes your daily experience the most. When people hear about a routine like this, they sometimes expect either a miracle or nothing at all. But the body rarely works in such dramatic extremes, especially when age-related changes have developed slowly over years. What often matters most is the combined effect of several small supports working together in a steady way. You are warming the ears, bringing attention to sensation, easing tension behind the ears, loosening the neck, and calming the nervous system. You are also inviting the brain to listen more actively instead of remaining trapped in strain and frustration. Taken together, those actions may help some people feel clearer, calmer, and less worn out by conversation. That is why this routine is best understood as support for the whole listening experience, not only the ear itself. And for many older adults, that broader improvement may matter just as much as any single hearing measure. If you feel less tired after talking more, willing to join family conversations, and less tense during the day that matters. Quality of life is built from exactly those moments, not only from perfect test results or dramatic promises. Let us be honest, because honesty builds trust and protects older viewers from disappointment and unsafe expectations. You should not expect this routine to restore youthful hearing or replace professional treatment when treatment is needed. You should not expect instant dramatic permanent change after trying the steps only once or twice. What you may notice instead is something quieter, yet still meaningful and worth paying attention to. You may feel less pressure around the ears when you wake up in the morning. You may feel your neck is looser, your jaw is less tight, and your body is calmer before conversations begin. You may notice that listening feels a little less tiring, especially in simple one-on-one situations. You may also become more aware of when your hearing is worse when noise affects you and when you need help. That awareness alone can be powerful because it encourages smarter next steps instead of silent endurance. In healthy aging, progress is often measured not by dramatic transformation, but by increased comfort, function, and connection. And those gains are never too small when they help you stay present with the people you love. It is very important to know when a gentle home routine is not enough, and medical advice is the safer choice. If your hearing suddenly becomes worse, do not wait and hope it simply returns without evaluation. If you hear ringing in one ear, notice strong imbalance, feel pain, or sense a major difference between both ears, get checked. If people constantly sound unclear, even in quiet spaces or loved ones, often say your television is extremely loud, mention it. If family members have been encouraging you to test your hearing, that may be a sign worth taking seriously. Professional hearing care is not a failure, and using more support is not a loss of independence. In many cases, it is the very thing that protects independence by making communication easier and safer again. Early evaluation may also help identify wax buildup, infection, medication issues, or other causes that need direct attention. So, please hear this clearly: daily care is valuable, but clear symptoms deserve a real medical conversation. The best approach is not choosing one or the other, but combining wise self-care with timely professional guidance. At the deepest level, hearing is not only about volume, clarity, or the mechanics of the inner ear. It is also about belonging, response, memory, humor, safety, and the feeling of still being part of the room. Many older adults do not grieve the sound itself, as much as they grieve what the missed sound represents. A joke missed at dinner can feel like distance. A grandchild's quick question can feel like a chance gone before you even knew it was there. A conversation you stop trying to follow can become a habit of withdrawal before anyone else notices the change. That is why paying attention to hearing is an act of self-respect, not vanity and not weakness. It says your voice still matters, your relationships still matter, and your place in the conversation still matters. The body may change with age, but the need for connection does not grow smaller with the years. If anything, it becomes more precious, more grounding, and more worthy of protection through small daily acts of care. You do not need to master everything at once, and you do not need to memorize the entire routine today. You can begin with the very first step by simply warming your ears gently with your palms and taking one slow breath. Then tomorrow, add another step, and the next day add one more if your body responds comfortably. Within a week, the routine may begin to feel natural, familiar, and easy enough to keep near your morning habits. That is often how lasting change works in later life, through repetition that feels kind rather than demanding. Please be patient with yourself, because caring for the body is not a race and never needs to become one. If today's message spoke to you, let it remind you of something simple and deeply true. It is not too late to care for your hearing. It is not too late to protect your comfort in conversation. And it is never too late to give your body the attention it has been quietly asking for. Your ears are still listening, and your life is still waiting for your full presence in every possible moment.